Hello and welcome everyone. We are into the topics of factors affecting drug response, and we have already seen different factors. So let's start with one more factor, that is tolerance. Now, this tolerance and tachyphylaxis thing we have already discussed in brief in a topic, that is receptor regulations. Let's see what are there. So tolerance is basically decreased response. Tolerance and tachyphylaxis both are decrease in the response, but tolerance develops over the longer period of the time. So requirement of the higher doses to produce is the same response, that is tolerance. So you need to give higher doses to produce similar kind of a response, and gradually this kind of thing happens. The tolerance is of two types, natural and acquired. So natural means inherently they are less sensitive to the drugs. For an example, rabbits are tolerant to the atropine, so inherently they are tolerant to the atropine drug. But acquired tolerance is the main tolerance, which depends and develops gradually over the period of time due to repeated use of drugs. Initially it was responsive, and gradually it becomes less responsive. For an example, tolerance to the analgesics and euphoric actions of the morphine. So morphine is having a different actions. One of the important actions are analgesic action, which relieves the pain, and euphoric actions, that is psychomimetic action. So tolerance develops to this kind of actions. So tolerance develops to analgesic actions and euphoric means over the period of time, if you expose the body to the morphine continuously over the longer period of time, gradually the pain killing effect and the euphoric action decreases. Now you need to gradually take more and more doses to produce similar effects. But here the exception is constipation and meiotic actions. Means against these effects, constipation and meiotic effects, there won't be development of any tolerance. So morphine would still produce constipation, and morphine still will produce meiotic actions even after exposing the body for longer time. So if you want to identify clinically a morphine addict, meiotic pupil and the constipation complaints are the two major things from which you can identify this patient is chronic morphine addict. So this is how tolerance works. Now, what is cross tolerance? One more terminology is cross tolerance. Cross tolerance means development of the tolerance to pharmacologically similar related drugs. So, development of a tolerance to pharmacologically related drugs. If two drugs, drug A and B, are pharmacologically somewhat related, and if tolerance develops against drug A, then there are chances that drug B is also tolerant. So that is called cross tolerance. For an example, alcoholic patients are tolerant. Sorry, alcoholic patients are tolerant to drugs like barbiturates and general anesthetic agents. So patient is taking drug A, that is alcohol, and as the barbiturates are also CNS depressant as the alcohol, patient becomes tolerant to barbiturates and general anesthetics as well. So that is called as cross tolerance. Now this tolerance, how now the question is why this tolerance develops. What are the mechanisms why this tolerance develops? So this tolerance can be of pharmacokinetic. The example is barbiturates and carbamazepine induces their own metabolism. So example is barbiturates. Now what are these barbiturates? We have already seen in metabolism sections that barbiturates are enzyme inducers, even carbamazepine. So what does enzyme inducers do? These drugs induces the enzymes. So because their metabolism becomes faster. So these drugs induces their own enzyme. So barbiturates metabolism increases. Again you are giving barbiturate, their metabolism increases and concentration decreases. So what happens? What is the effect? So now you need to take more and more doses every time because this barbiturate is inducing its own metabolism. So concentration would be decreasing. So you need to get higher and higher doses to produce similar kind of effects. So that is called as pharmacokinetic because here the metabolic process is involved. One more example is renal excretion of amphetamine is accelerated after regular intake. So tolerance of amphetamine. But here the tolerance mechanism is not related to metabolism, it is related to excretions. Amphetamine is a stimulant drug, and this stimulant drug produces acidic urine. Stimulant drug produces acidic urine because of stimulations there are chances of anorexia. Patient do not eat well, and in that condition, in starving conditions, there are more acid release from the body, and this acid goes into the urine. So urine would be more acidic. Now, what is amphetamine? Amphetamine is a basic drug. So basic drug in acidic urine would be ionized, and this ionized drug won't get reabsorbed and it will get excreted faster. So fast excretion. And because of these fast excretions, again you need to take higher doses to produce to get the same concentration. Again you need to take higher dose to get the same concentration, and this is how the tolerance develops. So here we have seen two pharmacokinetic mechanisms of tolerance, one that was related to metabolism and second that was related to excretion. Related to metabolism, examples are barbiturates and carbamazepine, and related to excretion, example was amphetamine. That was pharmacokinetic mechanisms of development of tolerance. Let's see about pharmacodynamic mechanism of development of tolerance. So decrease in the response due to any pharmacodynamic mechanisms, and that is due to desensitizations and down regulations that we have already seen, that because of continuous exposure of an agonist to the receptor produces either decrease in the number of receptors because of lysosomal destructions due to internalizations, and that is called as down regulations, or decrease in the sensitivity of the receptors, okay, and that is desensitizations, and that might be because of at the level of mechanism of receptor, there might be faulty mechanism of receptors, there might be faulty signaling or any inhibitory protein generation which alters the signal processing of that receptors. So examples of this pharmacodynamic tolerance are morphine, barbiturates again, and nitrates. Again, if we'll see these drugs, this is very important. Nitrate tolerance is very important, and because clinically, what is the clinical significance of that? Because of these characteristics of tolerance, we cannot give this drug to the patient for longer period of time continuously. Important word is continuously. So we should have always a breaking period, or you can say a resting phase where you do not expose the drug to the patients so that again receptor comes back to the normal state and again response is produced. So we'll discuss at in the nitrates section, we will see cardiovascular system. But these are the two basic systems of development of tolerance. One was related to pharmacokinetic, and second that is related to pharmacodynamics. So from tolerance that was developing gradually over the period of time, exception was natural tolerance that was inherited, but acquired tolerance takes time to develop, and the mechanism we have already discussed. Now let's jump to the next topic, and that is very very important and frequently asked in examinations, that is tachyphylaxis. What is tachyphylaxis? Here also there is decrease in the response. Here there is decrease in the response, but that happens very quickly. So rapid development of the tolerance. So it's a kind of a rapid tolerance. So rapid decrease in the response when the doses of drug repeated in quick successions results in decreased response. So if you expose the drug very quickly, or if you give the drug repeatedly in quick successions, there would be faster development of the tolerance or faster decrease in the response, and that is seen in some drugs. Few drugs produces this kind of response, and that is called as tachyphylaxis. Which drug produces this kind of response? So drug which produces tachyphylaxis are ephedrine, tyramine, and nicotine. This drug we'll see in ANS section, autonomic nervous system sections. Now these drugs acts by releasing catecholamines in the body. So now the question is, why this drug produces tachyphylaxis? As we have already seen in tolerance, Why the tolerance? Same way there was in tolerance there were two mechanisms, either at the pharmacokinetic level or pharmacodynamic level. Here it's very specific about those drugs, because here are very few drugs that produces tachyphylaxis, and it is very specific. These are ANS drugs, and if I'll discuss these things in brief, in autonomic nervous system there is presynaptic neuron and there is postsynaptic neuron. From the presynaptic neurons, there is release of catecholamines, for an example, norepinephrine, and this norepinephrine works on receptors, especially alpha receptors and beta receptors. We'll discuss. After the action, this norepinephrine's action gets terminated by reuptake of this norepinephrine presynaptic flow. So norepinephrine again gets reuptaken into the presynaptic neuron. This norepinephrine actually gets released from vesicles. There are stored vesicles, and from which this norepinephrine is released upon stimulations. So how this drug works? This drug works by releasing catecholamines. So these drugs work somewhat here and releases more amount of norepinephrine. But why on giving regularly or in quick succession the response decreases? Reason 1. Synthesis of those norepinephrine is unable to match with the rate of release. Now for an example, this is a graph showing the effect of norepinephrine on blood pressure. So you are giving first dose of norepinephrine here and the blood pressure rises, it again comes back to normal. In quick succession, again you are giving norepinephrine. Now the response would be a bit lower than the previous one. Again you are giving norepinephrine in quick succession, the response would be a bit lower, and again you are giving, there would be lesser response. So giving on quick succession, the response on blood pressure would be decreased. Why? Because of the first reason, you are constantly stimulating these presynaptic terminals, but the stored norepinephrine is in limited quantity. There is a process of synthesis of norepinephrine, but it is quite slow in comparison to the stimulations. So here the synthesis process is quite slow and your stimulating process is fast. So because of stimulation, norepinephrine releases, and so store of norepinephrine gets depleted eventually, and because of that the response gradually decreases. That is first reason. And the second reason is because this norepinephrine attaches with the alpha receptors and produces its response, and once it attaches to the alpha receptors, there is slow detachment of a drug. There is slow detachment of a drug from the receptors, and because of that there is constant stimulation of these receptors, and which might produce down regulations and desensitizations. Although these things takes time, but there is a hypothesis or a theory that this mechanism might be involved in decreased response. So, but the most important mechanism is this first mechanism. There is depletion of norepinephrine, which is quite logical, and second is down regulations or desensitizations because of the slow detachment of a drug from the receptors. So hope you are cleared about tachyphylaxis now. And the last portion about drug resistance, we'll discuss all these things in antimicrobial sections, but let's talk about briefly what drug resistance means. It's again decreased response of antimicrobial drugs. Antimicrobial drugs are developed, against those microbes which infects the body. So their response gradually decreases, or if their response decreases, that is called as drug resistance. And there are several mechanisms by which this drug resistance is produced, and it's a burning topic, very important thing in India because of the improper use of antibiotics. Many prescribers are prescribing antibiotics randomly or in cases where it is not needed, and because of that this drug resistance is developed and this antibiotic becomes unuseful or unsuccessful and incapable now to destroy that microorganisms. So tolerance of the microorganisms to the inhibitory effect of antimicrobial. Example is tolerance of penicillin in the staphylococci. That is one example you can remember. So let's talk about that and let's keep that in Up to that only, in detail, we'll see drug resistance in antimicrobial sections.